Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned obstetrician and gynecologist, a gold medalist, and a student teacher to the teachers. Her students are all over, and she retired as a professor, head of the department of Bangalore Medical College, and now she is continuing her service. And she is also a prolific writer. She has written lots of books for the benefit of the public to bring awareness. Today, she is going to talk to us about the stillbirth, why the stillbirth occurs, how to prevent it, and what the mothers have to take precaution, and what are the remedies that are available today in the science. So, welcome, Dr. Sunanda.
Thanks for
Please
the
tell us,
opportunity.
please tell us what is the stillbirth.
Stillbirth means when the baby is born, no sign of life, like a heartbeat and no movement, no respiration. That is called as stillbirth. After the birth of the baby, if baby dies, that is called as neonatal death. So this can happen during pregnancy or during labor. During pregnancy, it could be due to some congenital anomaly in the fetus, or it could be some mother gets some infection and then she get rashes and all that. So any reason which decreases the oxygen to the placenta, that can cause the deficit, this hypoxia in the baby, and that can kill the baby. And then small babies, the very small, like a bonsai baby, if they're very small, usually the chromosomal defect will be there in them.
Yeah.
And sometimes
they're
there may
not
be,
growing to the age. They
yeah,
have to grow and they don't grow and they remain
to their
like
to their
that.
potential, to their potential,
Potential.
they
Yes.
don't grow.
Yes.
And then sometimes the placenta usually should detach after the birth of the baby, but instead
Okay.
it can detach first before the birth of the
Oh.
baby, or sometimes there may be bleeding before the birth of the baby,
So
or
the
sometimes
baby is cut
mother
off from all the blood supply.
blood
And
supply,
that, oh, yes. Okay.
and sometimes mother may be suffering from jaundice, some fever also. And then during birth, it may be trauma, any trauma. So while coming through the passage of the mother, if suppose the baby is big, and if the baby is small also, very small baby also get traumatized because of the bony architecture. That's why they say even the small baby, premature baby also nowadays we do section so that baby,
Okay.
because pediatricians are good now, so
Right.
they've got all the facilities and baby can survive.
Hmm.
And then the causes may be in the mother or maybe in the fetus, maybe in the placenta also. So mother may be having diabetes, hypertension, and then preeclampsia, or due to BP due to any reason. And the also advancing age of the mother is also one of the reason. And then smoking of my mother, obesity, and she may be drug addict, and usually seen in
Ah,
the
now this is very, very important. Nowadays, the mothers have started taking alcohol, smoking, and drugs, and that is killing their babies. So, one
yes.
is the fetal alcoholic syndrome because of the alcohol, or the drugs, they can destroy and they can have the stillbirth. So, the mother should be very, very careful when they are pregnant. Yeah,
Yes,
please.
nowadays the girls they take this recreational drugs that can cause, and they don't care. They don't come for the antenatal checkup at all. In that case, this happens. And then so the mother should be alarmed. We tell the mother if there is fetal movement to record it after breakfast, lunch, and dinner every day. And if the fetal movements, if she feels less, immediately she should come and see the doctor. And then when we see the height of the uterus will not correspond to the period of gestation, and the no fetal heart sound. That can be confirmed nowadays by the ultrasound. Previously,
How?
we used to keep
Yes.
the fetoscope and see, and then
Yes.
it can be confirmed nowadays by this. And then when we discharge the patient, we write everything
In
because
detail.
all stillbirth we cannot explain why.
Hmm.
So whatever we have done investigation that we write, and that they should not lose. And
Yes.
because it will be helpful for the next pregnancy, because in
Yes.
next pregnancy it should not recur. And then after the birth of the baby, we ask the patient
Hmm.
to do permission to do the this postmortem. Don't give, only educated they give. So if they give, that is well and good. So we can find out any problem in the inside, then we can send it
Now
for.
the fetal echo ultrasound they have come, so we know priorly that what complex congenital heart disease was there. So even without autopsy also we can do it. But if they agree, fine. Okay.
Now, there are many types of autopsies. Now we do verbal autopsy.
I know.
Now she
Yes.
doesn't come
Correct.
bring the page. Then, or then if she doesn't agree for a autopsy, then we take X-ray. Okay. Then we can take the photos of the baby. Then we can do the MRI of the baby. Then we can take the, if you are suspecting something, needle biopsy we can take. And sometimes we can do laparoscopy also to find out the
Okay. Okay.
internal
Okay.
organ. So in a different way we can do all this, but
Yes.
that also needs permission.
Okay.
And then they now if the baby is inside and she is not delivering, and how long she can keep like that,
Like
So
obstructed labor.
so sometimes what they do, no, my baby is alive. They will not. They say, my baby is alive, and they go home. But if it is more than a month like that, then there will be bleeding problem, and
Yes.
mother may bleed to death. That's why we have to terminate the pregnancy. But
Yes.
and then after delivery, we have to give them the drugs or medicine to suppress the breast milk, and we have to advise them contraception, and we have to refer them to psychiatrist because they are depressed and they may
Okay.
worry
I
whether
know.
then the
I
next
know.
time also
Correct.
either it happens, and they may go, sometimes they may go for psychosis also. uh,
Yes.
because of the trauma and the stress and all that. So we do counseling for them. And the next time when they come for a checkup, we review their record and
Yeah.
what tests were not done last time, that we repeat. Sometimes we repeat, sometimes we do other tests which are done. For example, blood group, it is done once, it will be same.
Yes.
But
It is not
mm,
going to change.
yeah, some other
But
in
and the fetal echocardiogram is very, very important because I remember a lady, she had a stillbirth, and the second time when she became pregnant, at that time, the fetal movements reduced. She became very panicky and she came running, and they have done the cesarean section. But there was a pinpoint aortic stenosis, the hydrops fetalis. The hydrops fetalis means the water is loaded in the abdomen and the lungs and around the heart, and the heart is not able to pump, and 100% death. But then that patient was put on ventilator and sent to me. I put the catheter and opened that pinpoint aortic stenosis, and the baby survived within 14 hours. But this facility is not everywhere, and that's how people should, the high complicated cases or important babies, if they have lost earlier, the next time they have to take all the precautions. Yeah, please go ahead.
And I did one survey in Vani Vilas Hospital, not exactly stillbirth. I
Okay.
combined stillbirth and the repeated abortion, and then this one postnatally. First day only they die, postnatal death. To find out what happened, I did in 1,000 cases, and what I
Okay.
found in 1,000 cases, I did long back,
Mm.
and then
Mm.
what I found, they get a dream. I was analyzing their dreams, and what I
Oh.
found, they say, we are bringing a pot of water, and then it fell down, and then I was going in a forest, then I lost my way. Something like that they went on telling. So, uh, and subconsciously, it will be working in their mind. So,
Okay. Okay.
but we have to assure them that next time it will not happen. And
Okay.
sometimes it triggers. It triggers in whom? If the diabetes, if it is not treated, if the
Okay.
hypertension is not controlled properly,
Mm.
and then, for example, RH,
Mm.
it recurs, then we can give intrauterine transfusion to the baby. And
Baby.
then if there is a some other cause, we can treat it during
Mm.
pregnancy itself.
Mm. Mm.
So she need not worry.
Yeah. So now the facilities are so much, not only to detect, to treat also. So even the fetal interventions are possible now. So people should not worry, but only thing that they must come to the doctor in time, but not after the death. And that is the one. Yeah. Yes, sir.
And then during autopsy, what we can send, see some patella, that's the one bone
Mm.
near the knee joint we can send.
Mm.
And then we have a little finger, we have to cut it and send. That's why
Mm.
they have to give permission for these babies.
Okay.
And then
Okay.
sometimes what we can do, swab, whether there is infection, what
Mm.
is that cervical swab
Yeah.
we can take,
Septicemia. Okay.
septicemia and all that, that we can take. And then even sometimes placenta also we can send.
Okay.
what are the problems in the placenta, that also. So there, and then sometimes baby
So
may die due
sometimes
to,
they can have infarction or the death of the part of the placenta and they become liquefied and like a bubble, and that also can cause the death. So
so
the
we can,
problem may be in the
uh,
placenta also. Yes, you are
placenta.
rightly.
So
Yeah.
we can send it also. Uh, and then other investigations, for example, now your routine investigation everybody will do. Now, if there is no cause in the routine investigation, then what may be the other causes? That also we have to think. And many times what happens, they don't come for antenatal checkup because first time it has happened, even if you go to doctor, the same thing last time happened, like that. So
No negative thoughts. They should not think negatively. They must
yeah,
think that the doctors can do something, the God is with them, because the God helps those who help themselves. Unless they come to the doctors cannot do anything. And that's how we know mothers have to be very cautious. Yeah.
yeah. So next they have to leave their habits of like
Bad
alcohol,
habits. Yeah.
smoking, and they have to
Smoking,
reduce their weight,
taking drugs,
and then
and the
they
drugs.
drugs, especially drugs. And then during pregnancy, we do investigations and we advise them some medicines that they have to take regularly. And
Yeah.
the now goal is now India is trying to reduce this stillbirth. So nowadays
Yes.
the total amount of stillbirth is 6 lakhs per year. That is
Oh
about
my
22
God.
to
That's a big number. Okay.
a big number. So the
Mm.
goal is to reduce this
Mm.
stillbirth.
Mm.
For that, only doctors are not only doctors, even patient and their family members are
Family
also.
members. So,
Mm.
if you want to clap or if you want to do namaskar, both the hands are required. So, if you want to save the baby, both the doctors and the parents and the family should join hands for the effort. Otherwise, it is not possible. You are right. Yeah.
Okay.
Yeah. So that's
And
really nice, you have in detail explained what are the causes of the stillbirth, what is stillbirth, and you have given a hope for the mothers and the parents that there is a possibility of saving these babies from the certain death, because now the investigations and facilities are so much and we are capable of doing it. Finally, what advice you would like to give it to the mothers?
if see, they also should do sacrifice for their baby. They
Hmm.
should not become addict. They have to leave all those habits.
No, it is
Number,
not a
number two
sacrifice.
is
It is their duty,
it is their
dharma. It is
duty.
their dharma. Yeah.
And number two is they have to keep the record. And
Yes.
that they should not do it. That is very, very important. I am
Hmm.
yet to see the patients. Very rarely I see the patients who
Hmm.
keep their records.
Hmm.
That's why I asked them to keep the record
Hmm.
of the previous delivery. And then so first baby, second baby, they can keep the record. And why, even though the cesarean is done, but at what time it was done? During labor, it was done, or antenatally it is done. Even though the cervix is it's not dilated, that time they have done, or
Hmm.
during labor they have done.
Hmm.
So if it is done before that, then
Hmm.
the causes may be different. During
Hmm.
labor means it may be fetal distress or something.
Yes.
Even before the
And the fetal distress, if it is detected in time, the fetus can be saved. Yes.
yes. So that's why whether this time whether to give a vaginal delivery or this
Hmm.
time we should give our cesarean,
Hmm.
whether to do cesarean and
Hmm.
then or give vaginal delivery, and if the need arises we should do section, or should we do cesarean before she goes into labor. So
Labor.
for that
Yeah.
also we need all the records. And then
Yes. Yeah.
so in the record it is written that how much it is dilated and what they suspected, and if there is postmortem or if there is
Hmm.
something, everything they explain. It
Okay,
is
thank
written
you
and that
so
means.
much. Yeah, yeah. Thank you so much, Dr. Sunanda. It was so elaborately, so lucidly, so clearly you have explained to our viewers. And I'm sure whoever is becoming pregnant, they will take all the precaution and save their baby and then prevent themselves from going into the misery of losing the baby. Thank you very much.
Thank
Namaskar.
you. Thank you. Namaskara.